Hi, welcome to Level 3 Health and Social Care, Unit 7 Dementia. And we're looking at week 1, part 2, and we're going to look at some of the signs and symptoms of the dementias. Okay, so the objective for your assignment that we're going to address today is part 1.2, explaining the signs and symptoms of dementia. Okay, so fairly clear. Okay, so before we go on, maybe have a think for yourself. What do you think are the signs of dementia? Some of you have already been in placement in a care home, and you've probably come across people with dementia. Or if you haven't, you may have come across people elsewhere with, elderly members of your family, maybe, or neighbours, or people that you know, or other people's grannies and such like. So maybe jot down some ideas of what do you think or what to you might be a sign of dementia. See what you can remember. So before you move on to the next slide, just take a few minutes to jot down. And then as we go through the signs and symptoms, let's see sort of how many agree with some of your ideas and or what type of dementia you might be looking at in that respect. Okay. So as I said, take a few minutes, jot down some thoughts, and then we'll go on. Okay, so there are some common early symptoms which can work for any types of dementia. As we know, there are different types of dementia and they can affect you differently. But some of these common early symptoms could relate to any of the dementias. And one of the first things that really sort of comes up is things like memory loss. Okay. Difficulty concentrating where in an area particularly where you were able to concentrate before. Finding it hard to carry out tasks that are quite familiar to you, such as making a cup of tea or cooking a certain meal. If you sort of knew the recipe and you knew exactly how you did it before, you might sort of think, oh, not quite sure what I do next. One of my examples here is, when you go shopping and someone gives you the change, you're usually able to sort of give a quick look at it and think, yeah, that's right. But now you might not be quite so clear. You might have to sort of check it a few times. Struggling to follow a conversation, either concentrating on the conversation or not being able to think of the words that you want to use, like think of that right word. Being confused about time and place, not being sure what time it is, or not sometimes being 100% sure where you are as well. And mood changes, maybe mood changes that you're sort of not used to having, really. Some people suffer from mood changes a lot, so they might not notice that. But if you're someone who sort of, works on a fairly even keel, unless something upsets you, or mood changes that are maybe not common for you. These symptoms are often quite mild and they might just get worse gradually. And sometimes you don't really notice them until they've become a lot worse, really, in a way. And they're often called mild cognitive impairment, MCI, um, and they're not severe enough to be diagnosed as dementia. But if you go to your GP with some of these issues, maybe if you go for something else, then they might keep an eye on it for you and just say, well, let's see if it develops. You might not notice them yourself, and it might be something that your family and friends might notice before you, because sometimes, especially if it's someone who hasn't seen someone for a while, they might come and visit in a few months' time and think, oh, they don't seem to be so good at that anymore. Um, but usually, if you have MCI, these mild cognitive impairments, you will probably go on to develop dementia. Excuse my cold. Okay, so we've already talked about the fact that we've got Alzheimer's, we've got vascular, we've got Lewy body, we've got frontotemporal lobe, and they have a lot of common symptoms. But we also need to just identify some of the ones that are specific as well. Okay. And think about this when you're answering the question. You're only going to have so many words. There's an awful lot of symptoms here to mention. So, what I would suggest you do is just sort of do a couple of sentences on the ones that are common to all and say that, and then pick out, at least a couple of specific symptoms for each of the sort of 3 or 4 main dementias. So most common cause of dementia is Alzheimer's. So that's the one you can spend a bit more time on. Very common symptoms for Alzheimer's are memory problems, such as forgetting recent events, like short-term memory stuff. They might be able to remember something from 15 years ago, though. Names and faces, like, not being able to recognize people. I sort of know you, but just can't remember who you are, that sort of thing. They may ask questions repetitively because what you're saying isn't going in, I suppose, is a way of putting it. So they may have to keep asking questions until it sticks in their mind. They have more difficulties with little tasks, anything that requires a bit of planning. So, like, if they want to go and meet someone and go to the theatre, say, or go to the cinema, that needs a bit of planning. I've got to get the bus at this time, and get my ticket then, and that. They may have difficulties with that. You may notice they have difficulties with that. If you take them to a strange environment, they might get confused or a bit distressed sometimes if they're maybe out of their home. Difficulty finding the right words to say. They know the word, but they just can't pull it out. Difficulty also, the same sort of difficulty with numbers. Like if you give them a simple maths problem, not a complex one, but simple one that you should be able to do, mental arithmetic, they may struggle with that. So that's why handling money is often an issue. They might be able to do the sums. The result of this, they might become more withdrawn and anxious because they feel that things aren't quite right. As the conditions develop, it moves into 3 stages. As you can see, there's the mild stage or early stage, the moderate or mid stage, or the severe or late stage. You can use my graph to help you break it up. Memory problems become more severe and other symptoms can develop, such as confusion, disorientation, starting to get lost in familiar places as well as unfamiliar places. More difficulty with planning, so they become decision-making process becomes quite difficult because it's those processing parts of the brain that are affected. More problems with speech and language, more struggling with words, finding the right word, recognizing the right word. More problems, some physical problems start to come around, more problems with moving around without a little bit of help, or maybe using a walker or something like that. And more problems performing self-care, like not being able to remember how to put their shirt on, or the order of putting their clothes on, pants, trousers and socks maybe. Personality changes. People might become more aggressive, more suspicious, a little bit paranoid maybe, or they could become more demanding, or they could be they become quite intolerant or impatient. And not for everyone, but for some, in the later stages, hallucinations, hearing and seeing things that aren't there, and delusions, believing things that are not true, like that you've lied, and it goes in with the sort of paranoia a little bit as well. And they can be very distressing, both for the person and for the people around them, because they may accuse their nearest and dearest of, trying to poison them or trying to hurt them in some way. And no matter how much you protest it, it's quite difficult for them to believe. And low mood or anxiety, and that really comes because these things are becoming out of their control, really. It's not really a surprise that they might end up getting very anxious or very depressed. Okay, So let's look at those that are specific to vascular dementia. And they are quite similar, although memory loss may not be quite as obvious in the early stages. So I think that's worth a mention if you're going to write that up. Okay. Vascular dementia symptoms can sometimes develop quite suddenly and quickly get worse, and that might be because of the effects of a stroke. So if you have quite a severe stroke, it can just happen poof out of the blue, whereas Alzheimer's is definitely a slow progression. But just to be difficult, they can also develop gradually, like Alzheimer's as well. So, but when they do happen out of the blue like that, then you can pretty much say it's vascular dementia. Also, the stroke-like symptoms, all the things that we know about stroke, muscle weakness, paralysis, because we know that for a lot of people with vascular dementia, it's the stroke that starts it, really. Movement changes, difficulty in walking, again, that could relate to weakness or paralysis, or it could just balance will be affected as well. Thinking problems that have difficulty with maintaining attention, and similar to Alzheimer's, the planning and problem solving part will go. Mood changes, again, the same as Alzheimer's. Depression, and a tendency to become more emotional when maybe they were not particularly beforehand. Now, I mean, I'm not really clear. I'm not sure if I've seen any research that says whether depression is just something that happens or whether it's as a result of, some of these complexities, which probably make most people depressed or upset, really. So, hard to say. Lewy body dementia. It causes problems with mental difficulties. Some of the difference, they tend to come on quite slowly and get slowly worse. There are some things that there are some treatments that you can give that can actually slow this process down with Lewy body. We'll look at that when we look at some of the treatments. Some of the issues, particularly for Lewy body, is about thinking speed, not being able to think as quick as maybe you did before, understanding, losing the comprehension of what people are saying to you, loss of judgment. Maybe you're quite sensible and safe before. Your safety might, so your judgment might be affected. Visual perception will be affected. Language can be affected as well. So again, you might struggle for words that you had before. Memory, not quite as much as in Alzheimer's. Significant memory loss will occur actually much later down the line with Lewy body. So it's not one of the symptoms that you look at first. It's mainly more the sort of thinking processes. And the thing with Lewy body is they may consist. You can either start to have these problems consistently, but unusually with Lewy bodies, they can come and go. So they can have like good months and bad months, or good weeks and bad weeks, where some of these things are there and then they're a bit better the next week, but then they're not so good again afterwards. And that's a little bit different. So that's something worth a mention as well. There are other particular symptoms for Lewy body, hallucinations, confusion, which can also be changeable on and off. Hallucinations can come and go as well. They can have movement affectations, which is not so much so with Alzheimer's, like quite stiff limbs and tremors, very much like Parkinson's. Often when they see that, people may diagnose it as Parkinson's because it's more common. But then once they'd have to do more tests to sort of decide it's Lewy body dementia. Fainting and unsteadiness on feet, so a bit lightheaded, so unsteadiness, so more falling really. Lots of disturbed sleep, some difficulty swallowing, Depression, but again, we don't know if that's an effect, cause or an effect. And daily activities become problems. It becomes a problem really because of all this unsteadiness, the shaky hands. It becomes quite difficult. So people can't make a cup of tea. It's not that they can't remember how to, it's that they physically, can't really do it that well. Okay, so it's a little bit different, Lewy bodies. Let's think about how you write that up. Frontotemporal lobe dementia. Remember, it sort of comes on earlier. More symptomized by personality changes than anything else. Reduced sensitivity to other people's feelings, making them seem cold and unfeeling. So they might have been, quite warm when they were younger, but now they're a little bit switched off. They can come over as, thoughtless, inconsiderate, self-obsessed, that sort of thing. Lack of social awareness, so they can be inappropriate. They make jokes which are, might offend other people, or they could be not very tactful. They could speak out when they shouldn't, call someone fat or ugly or something like that. Or they could just, another option is they could be quite withdrawn and apathetic, disinterested in things as well. Same sort of issues with language problems, difficulty in finding the right words or sometimes understanding words. They can become obsessive, which is, this one's quite special to frontotemporal, become obsessive, such as developing fads for unusual food, overeating or drinking, or undereating and drinking sometimes as well. So they might just get fixated on certain meals. Now, this is one, as I said, that Bruce Willis was diagnosed with. So, which is probably a little bit why he's maybe not being seen in public quite so much, because some of these issues can be, someone who's quite famous can be socially difficult. And you may note that I have a graphic with a picture of Donald Trump. I'm sure some of you know who Donald Trump is. And there's one thing that's quite unusual about frontotemporal dementia is this unusual stance. If you can have a look at the graphic. It's really quite unusual. It's quite stiff. It's quite awkward. They have this sort of balance thing where they stand with their legs back and their body leans forward. If you can see there in the graphic. And this is a stance that I've found loads of photographs of Donald Trump holds this very classic frontotemporal lobe stance. Now, I've put some of the issues there, and it's up to you whether you think. I mean, he's of the right age. He's over 70. Stiffness and awkward gait, poor judgment, loss of empathy, socially inappropriate behaviour, lack of inhibition, repetitive, compulsive behaviour, inability to concentrate, frequent and abrupt mood, speech difficulties, balance or movement. We know he has balance and movement issues because he struggles with stairs quite a lot. He doesn't concentrate very well. In fact, he's not interested in detail. So, I mean, that could be a long-term personality thing. He's got compulsive behaviours. He'll only eat certain meals in public. In fact, I think he just eats burger and fries, and he only drinks Coke. So when he eats, it's pretty much the same meal he's had for many, many years. He has very limited empathy for other people. And he's sometimes quite socially inappropriate. He's very rude to people when you would expect someone at that level when he was president not to be, but he still carried on being quite so. Some people called him a sociopath, but I wonder if he has frontotemporal dementia. I don't know if I'm just being kind or not, or he could just be a nasty person as well. So symptoms in the later stage. So all dementias in their later stage end up with pretty much similar symptoms. Okay, so they are the memory problems. They start not being able to recognize close family and friends. Communication problems. They may even lose their ability to speak altogether. So you need, but they can manage to use non-verbal means, and they will recognize facial expressions. Mobility gets affected eventually with all dementias. So they're not able to walk about unaided. They may need to use, as I said, walkers, frames, but eventually they may not be able to even do that, and they require a wheelchair or end up staying in bed. Behavioural issues, um, agitation, depressive symptoms, anxiety, wandering. Again, those of you who are on placement have probably come across people wandering the corridors, getting up in the night, not knowing whether it's day or night, and sometimes being quite aggressive as well, these personality changes. And sometimes they have the hallucinations, and that can be quite shocking the first time you see it. After a while, you get used to it, and learn how to manage it. But it can be quite shocking when they're telling you that they're seeing something in the corner of the room that you don't see, but it can be quite difficult. Bladder incontinence in the late stages of dementia, and some people will have bowel incontinence. Appetite problems, because they have trouble, some may have trouble eating and swallowing. So it means that there's weight loss, or it's very hard to get food into them as well. Alzheimer's Society website is brilliant, for lots of information. So you could certainly go on and have a look at that. Okay, so we've covered all the symptoms. We've covered early stages and late stages. As you can see in the late stages, they're pretty much all the same. But there are some differences. So to answer the question for the signs and symptoms, like I said, you want to just give a couple of sentences, of overall, or the bits where they're having the same, or if not, you just want to do a couple of lines on each. I would stick to the ones that I've mentioned here. You don't go and find out about Huntington's and all that, because these are the big dementias. You can even just focus on vascular and Alzheimer's if you want. I would try to mention front row and Louis, because they have got some differences. So a couple of sentences in each of those, and then you could do a couple of sentences at the end, about later stages that they all have. Really, just pick out a couple of things. It's really up to you how you manage your word count. Okay, so that's all there is for symptoms in the later stages of dementia. There's no particular extra reading for this bit, but do have a look at the extra reading for week 1 in general anyway. Okay. Okay, thank you, and I'll see you in week 2.